Bharat Biotech's homegrown Covaxin and Serum Institute of India's Covishield by Oxford AstraZeneca approved for emergency use in India. DCGI. VG Somani says that the vaccines are completely safe. Prime Minister Narendra Modi congratulates the nation on the vaccine approval, expresses gratitude towards corona warriors. The World Health Organization also welcomes India's decision, giving emergency use authorization. The BJP slams the Samajwadi Party chief Akhilesh Yadav's controversial statement that he doesn't trust the upcoming COVID vaccine, terms his comments as irresponsible. Rain lashes Delhi NCR and adjoining areas, bringing respite from the pollution. The IMD predicts more intense rain in Delhi NCR over the next 3 days. Namaskar and welcome to the news. My name is Mark Lynn. Here's our top story. It's a historic moment for India and India's fight against COVID-19. The Drugs Controller General of India today approved vaccines of Serum Institute of India and Bharat Biotech. The Controller General has granted the permission to both the vaccines for restricted use in emergency situation.
Adequate examination. The CDSCO has decided to accept the recommendations of the expert committee, and accordingly vaccines of Messrs. Serum and Bharat Biotech are being approved for restricted use in emergency situation, and permission is being granted to Messrs. Cadila Healthcare for conduct of phase 3 clinical trial in India.
Making a press statement, the DCGI said that Bharat Biotech has developed the whole virion inactivated coronavirus vaccine that's called Covaxin in collaboration with ICMR and NIV Pune. This vaccine is developed on ViroCell platform, which has a well-established track record of safety and efficacy in the country and globally as well.
Messrs. Bharat Biotech has developed a whole virion inactivated coronavirus vaccine named Covaxin in collaboration with ICMR and National Institute of Virology, Pune, from where they received the virus seed strains. This vaccine is developed on ViroCell platform, which has well-established track record of safety and efficacy in the country and globally.
The DCGI, beg your pardon, also said that phase 1 and phase 2 clinical trials were conducted in approximately 800 subjects, and the results have demonstrated that the vaccine is safe. It provides a robust immune response. Let's listen.
Phase 1 and phase 2 clinical trials were conducted in approximately 800 subjects, and results have demonstrated that the vaccine is safe and provides a robust immune response. The phase 3 efficacy trial was initiated in India in 25,800 volunteers, and till date approximately 22,500 participants have been vaccinated across the country, and the vaccine has been found to be safe as per the data available till date.
And applauding the hardworking scientists and innovators of the country, Prime Minister Narendra Modi took to Twitter to congratulate the nation. He said, and I quote, "A decisive turning point to strengthen the spirited fight. DCGI granting approval to vaccines of Serum Institute of India and Bharat Biotech accelerates the road to a healthier and COVID-free nation. Congratulations, India. Congratulations to our hardworking scientists and innovators. It would make every Indian proud that the two vaccines that have been given emergency use approval are made in India. This shows the eagerness of our scientific community to fulfill the dream of an Atmanirbhar Bharat, at the root of which is care and compassion. We reiterate our gratitude to doctors, medical staff, scientists, police personnel, sanitation workers, and all corona warriors for the outstanding work done, that too in adverse circumstances. We will remain eternally grateful to them for saving many lives." And the Home Minister has also tweeted, and we shall show you those tweets. The Covaxin is, as we said, here's what the Home Minister Amit Shah has tweeted: a momentous achievement for India. DCGI has granted approval to COVID vaccines of Serum Institute and Bharat Biotech. I salute our very talented, hardworking scientists for making India proud. Congratulations to Prime Minister Narendra Modi ji for striving towards a COVID-free India. And the Union Health Minister Dr. Harsh Vardhan said that the wait for COVID-19 vaccine is over, with Covishield and Covaxin approved for emergency use in India. The Health Minister tweeted and said, a watershed moment in India's famed battle against COVID-19 under the charismatic leadership of the Honorable Prime Minister Shri Narendra Modi ji. These vaccines are a fitting tribute to our corona warriors. My heartfelt gratitude to all healthcare professionals and frontline workers for their exemplary efforts during these unprecedented times. Congratulations to all the scientists and researchers for their untiring efforts. It's now time to reap the benefits of the robust supply chain infrastructure we put in place for quick and equitable distribution of the vaccine. Urge all citizens to entrust the stringent protocols followed for ensuring safety, efficacy and immunogenicity. This is of the approved vaccines. The Union Information Broadcasting Minister Prakash Javadekar extended greetings to the nation, called it a historic moment for India. The IMB minister tweeted and said, a big and historic moment for India. Indian vaccine is a reality now. Thank you, Narendra Modi ji, for this significant and reassuring announcement. And the Home Minister Amit Shah has also tweeted, visionary leadership can make a huge difference time and again. We have seen a new India eager to innovate and help humanity during crisis. The approval to Made in India vaccines will prove to be a game changer in boosting Prime Minister Narendra Modi's vision of an Atmanirbhar Bharat. The Principal Scientific Advisor to the government, K. Vijay Raghavan, congratulated the people of India on the approval of the two major vaccines for COVID-19. He said, and I quote, congratulations all, vaccination will begin soon. This is a result of focused work by scientists, national laboratories, government agencies, regulators, healthcare workers, and most importantly, all our people who have waited patiently following all COVID-appropriate behavior. He further tweeted, there are full vaccination measures in place across the country. All should follow these protocols systematically and fully. Everyone will get their turn. We should start by ensuring that those who look after us, health and frontline workers, are first safe. The WHO, the World Health Organization, has welcomed India's decision giving emergency use authorization to COVID-19 vaccines. In a picture shared along with the tweet, Dr. Poonam Khetrapal Singh, who is the regional director of WHO Southeast Asia region, said that the WHO welcomes the first emergency use authorization given to COVID-19 vaccine in WHO Southeast Asia region. As India approves two COVID-19 vaccines for emergency use, the Director of AIIMS, Dr. Randeep Guleria, in a video message has cleared doubts on the process of vaccination in the country. The eligible beneficiaries will be informed through registered mobile numbers, and he said that the frontline COVID-19 workers will be vaccinated first. Let's listen.
Namaste, I'm Dr. Guleria. I know that many of you have some questions as far as the vaccine is concerned, and let's try and address some of them. In the initial phase, COVID-19 vaccine will be provided to priority groups, and these include healthcare workers, frontline workers. Those above the age of 50 may also get vaccinated early depending upon the availability of vaccine. The eligible beneficiaries will be informed through the registered mobile number regarding the health facility where the vaccine will be provided and the scheduled time for the same. This will be done to avoid any inconvenience in registration and vaccination of beneficiaries. No, I don't think that would be right. Registration of beneficiary is mandatory for vaccination of COVID-19. Only after registration, the information on the session site to visit and time will be shared with the beneficiary. So any one of the documents that I'm going to be mentioning with photo may be produced at the time of registration, and these include driving license, health insurance smart card issued by the scheme of Ministry of Labour, Mahatma Gandhi National Rural Employment Guarantee Card, the Manrega job card, official identity cards issued by MPs, MLAs, MLCs, PAN card, passbooks issued by the bank or the post office, passport, pension documents, service identity cards issued to employees by the central, state government, public limited companies, or voter ID cards. The photo ID produced at the time of registration must be produced and verified at the time of vaccination. Photo ID is a must for both registration and verification of beneficiary at session site to ensure that the intended person is vaccinated. Following online registration, beneficiary will receive SMS on their registered mobile number on the due date, place and time of vaccination. Yes, on getting due dose of COVID-19 vaccine, the beneficiary will receive SMS on their registered mobile number. After all doses of vaccines are administered, a QR code based certificate will also be sent to the registered mobile number of the beneficiary. Yes, I would request that you take some rest for at least half an hour after taking the COVID-19 vaccine. And if you have any symptoms, any discomfort, please inform the nearest authorities, the ANM, the ASHA workers, so that they can attend to you if there is any problem that you have. Remember to continue following key COVID appropriate behaviors like wearing of masks, maintaining hand sanitization and physical distancing, that is 6 feet or 2 gaj ki duri.
Well, India has successfully cultured the new viral strain, the UK variant of SARS-CoV-2, and no country has yet reported successful isolation and culture of the UK variant of SARS-CoV-2. The Indian Council of Medical Research, ICMR, said that SARS-CoV-2, the virus causing COVID-19, was tracked through countrywide network of ICMR laboratories since earlier days of the epidemic in India. The ICMR said that the UK variant of the virus, with all signature changes, is now successfully isolated and cultured at the National Institute of Virology, NIV, from the clinical specimens collected from UK returnees. ICMR said that virocell lines were used by the scientists of ICMR NIV to culture the UK variant of the virus. 29 cases of the new strain have been detected in the country thus far. A massive nationwide dry run was successfully conducted on Saturday for the COVID-19 vaccination. The real-time monitoring capability of the specially developed CoWIN app was also tested during this drill. The CoWIN software has been developed by the Ministry of Health and Family Welfare for real-time information of vaccine stocks, their storage temperature and individualized tracking of beneficiaries for COVID-19 vaccine. This software will assist the program managers across all levels through automated session allocation for pre-registered beneficiaries. Their verification and a digital certificate will be generated upon successful completion of the vaccine schedule. CoWIN platform will also facilitate scheduling, inoculation, SMS reminders for schedule and follow-on dosage, reporting adverse event following immunization and certificate post-vaccination. More than 75 lakh beneficiaries have been registered on CoWIN software till date. The Union Health Minister Dr. Harsh Vardhan said in a tweet, and he informed that the priority beneficiaries have been identified and an advanced digital platform CoWIN has been developed to ensure equitable vaccine distribution. The COVID-19 immunization drive in India will be the largest immunization in the world. Union Health Minister in a tweet has informed about the intricately designed vaccination centers. Every vaccination center will have separate waiting, vaccinating and observation room. A 5-member team will be present to cater to 100 beneficiaries. Also, additional personnel will be deployed for more beneficiaries. There are kits, anaphylaxis kits. These are going to be provided to each vaccination center to manage the adverse events after immunization. Well, India has crossed yet another significant milestone in its fight against COVID as the active caseload in the country has decreased further. It's now 2.39%, and well, with continuous decline in this number of active COVID-19 cases, the active cases in the country has witnessed a decline of nearly 4,000 cases. It stands at around 2,47,000. So the national cumulative recovery rate has improved further. It's now 96.16%, the recovery of over 99 lakh people thus far. And India has recorded one of the lowest new cases per million population in the last 7 days. So Brazil, Russia, France, Italy, the US and the UK have much higher cases per million population reported in the last 7 days. ICMR, which is the apex body in conducting tests throughout the country, has continued in its fight against this coronavirus, and ICMR has conducted 17,48,99,783 samples. These were the tests done, and a total of 9,58,125 COVID tests were done on January 2. Prime Minister Narendra Modi will deliver the inaugural address at the National Meteorology Conclave on Monday. He'll do so via video conference. He will also dedicate the National Atomic Time Scale and the Bharatiya Nirdeshak Dravya to the nation on the occasion. The Prime Minister will lay the foundation stone of the National Environmental Standards Laboratory. The National Meteorology Conclave 2021 is being organized by the Council of Scientific and Industrial Research, the National Physical Laboratory, this is all in New Delhi, which is entering into its 75th year since its inception. So the theme of the conclave is meteorology for the inclusive growth of the nation. The National Atomic Time Scale, it generates Indian Standard Time with an accuracy of 2.8 nanosecond. The Bharatiya Nirdeshak Dravya is supporting testing and calibration of laboratories for quality assurance at par with international standards. The National Environmental Standards Laboratory will aid self-reliance in the certification of ambient air and industrial emission monitoring equipment. The Bharatiya Janata Party has slammed the Samajwadi Party chief Akhilesh Yadav's controversial statement of a vaccination drive. Reacting to the SP chief's comment, the BJP spokesperson Sambit Patra said that such comments are baseless and they should not come at a time when the whole country is fighting against COVID-19. Patra said that it is very irresponsible. It's an irresponsible comment made by the SP chief.
As far as the comment of Mr. Akhilesh Yadav regarding COVID-19 vaccine is concerned, it is absolutely, I would say, irresponsible comment, and it's a very serious comment in the sense that today we need to instill confidence in the people of this country about the vaccine of COVID-19. Ironically, what Mr. Akhilesh Yadav says, that this is a BJP vaccine, that I would not get vaccinated, only spreads rumors and canards in the people of this country.
Well, reacting to that statement, the Union Minister Anurag Thakur also said that it's very unfortunate that Akhilesh Yadav has made such a controversial statement.
दुनिया भर के वैज्ञानिकों ने अपना योगदान देकर अलग अलग कंपनियों ने वैक्सीन लाने का काम किया है ताकि कम से कम लोगों की जान जाए, एक एक जान को बचाया जा सके। और हिंदुस्तान के प्रधानमंत्री नरेंद्र मोदी जी ने जान भी जहान भी, इसी संदेश को लेकर देश के करोड़ों लोगों की जान भी बचाई। कोरोना महामारी से हम इकट्ठे मिलकर लड़े भी, राज्यों की सरकारों को साथ लेकर भी चले। अखिलेश यादव जी की ये टिप्पणी दुर्भाग्यपूर्ण है।
Well, the BJP leader and former Union Minister Rathore also condemned Akhilesh Yadav's comment over the vaccination drive. Rathore said that these kind of comments are upsetting.
कुछ लोगों ने टिप्पणी करी है, दुख होता है कि हमारे भारत के साइंटिस्ट के ऊपर शक करा जा रहा है, उनकी जो काबिलियत है उसके ऊपर शक करा जा रहा है। भारतीय होने के नाते मुझे गर्व है अपने साइंटिस्ट के ऊपर और हमारे फ्रंट लाइन वर्कर्स के ऊपर।
In Odisha's Puri, people from other parts of the state and outside the state, they were allowed to offer prayers at the Jagannath temple today. Devotees visited the temple with their COVID negative reports. The Puri Jagannath temple was open for public from today. And negative COVID-19 reports and Aadhaar cards are being strictly checked during the entrance. 15 platoon police force and 50 officers, they have been deployed by the Odisha police to control the rush. Let's take a look at the global update now on COVID-19 from across the world. As of now, over 8,49,00,000 cases have been reported worldwide, with over 18,42,000 deaths, and over 6 crore patients have recovered from the virus. The United States remains the worst hit country by this pandemic and has crossed the 2 crore mark. The US reported over 2,09,00,000 cases of the virus, and the death toll has surged past 3,58,000. Brazil follows the US in terms of death toll with over 1,95,000 deaths. Well, the US says that the spike in the number of daily COVID-19 fatalities since Thanksgiving, with at least 78,000 lives lost in December. So the US rate of new COVID-19 infections has increased in the second half of the last year. California has the most total cases of any state in the US, with about 2.28 million infections, followed by Texas with 1.76 million cases. Florida has at least 1.32 million cases. So the United States is averaging about 186,000 cases a day, and it's down up from the peak in mid-December, which was about in fact, 218,000 cases, 218,000 new infections per day. Health officials have warned that cases will likely spike again after the holiday gatherings. And the United States has approved 2 vaccines. The rollout is going more slowly than the government had hoped. About 2.8 million Americans received a COVID-19 vaccine by December 31st, falling far short of the 20 million target. The government's goal is 100 million shots in the arm by March 1. Well, Britain will allow people to be given shots by different COVID-19 vaccines on rare occasions, despite a lack of evidence about the extent and immunity offered by mixing doses. In a departure from other strategies globally, the government says that the people could be given a mix and match of the 2 COVID-19 shots if the same vaccine is not available. However, the Public Health of England, their officials say that this would only happen in extremely rare cases, and that the government was not recommending the mixing of vaccines, which requires at least 2 doses given several weeks apart. More than 20 new coronavirus testing centers, and these are for drivers who to France. They are being set up. This is in the next few days, as stated by the British Transport Secretary Grant Shapps, because Britain is also offering help to firms that wish to set up testing centers on their own premises. The move comes after France shut its border to the UK arrivals, including freight drivers, last month amid the concern over the new fast-spreading variant of the coronavirus, which was identified in the UK. It led to thousands of lorry or truck drivers being stuck in Kent as they waited to cross the English Channel. The French government later on ended its ban, but the drivers who wish to enter France from the UK, but they are now required to show proof of a negative coronavirus test, which is taken 72 hours earlier. Australia's most populous state, New South Wales, reported 8 new COVID-19 cases on Sunday, and neighbouring Victoria's tally increased by 3. The new measures to combat the disease have kicked in. In order to contain the surging virus cases, New South Wales has made wearing masks mandatory at indoor venues like gaming rooms, hair salons and shops, as authorities try to limit the spread of the disease. They will be legally enforced from midnight local time. The New South Wales outbreak started around mid-December in Sydney's Northern Beaches area, where 250,000 people are in strict lockdown. This is until January 9. Australia has avoided the worst of the pandemic following swift action by authorities to shut borders, to enforce lockdowns and to carry out widespread testing and social distancing. South Korea reported 657 new coronavirus cases for Saturday, the lowest daily infection total in nearly 4 weeks, as tougher restrictions during the New Year holiday season helped fight the spread. The country decided on Saturday to expand its ban on private gatherings larger than 4 people to include the whole country and extend unprecedented social distancing rules in Seoul and neighboring areas until January the 17th. And news now about the weather. Well, the national capital and adjoining areas have received rainfall this morning. It's brought some respite from the pollution in the city. The IMD has predicted the possibility of more intense rain in Delhi and the national capital region over the next 3 days as well. There is also a forecast of a hailstorm in Delhi on Monday. The minimum temperature will be around 7 to 8 degrees centigrade in the coming days because of the passing western disturbance. And with that, we conclude this bulletin. Thank you very much for being with us. Namaskar.